Hello, everybody. Thanks for coming to our little program here. I have to say this is my first time to IDS meeting, and I'm very impressed with the technology that is shown here, the digital world that's being represented here. What I want to talk about today is what I think is the most exciting thing in the whole meeting, which is using remote monitoring to help treat patients and provide more information, better communication with patients. So with that as a bit of an introduction, let me move on. When we look at the medical world and what goes on in the medical world, you can see an evolution that's occurred. It began with the pacemaker many years ago, a way to remotely monitor heart conditions and so forth. And as you look through the slide, you can see there's lots of things that have been going on that have added to the medical profession's ability to remotely monitor various medical problems. And that's been a boon to medicine, and it's been a boon to society as well. You might say, well, why did that happen? Why did medicine go this route? And here's my answer. There's really three reasons why medicine has chosen to go this route. The first is remote monitoring allows a greater efficiency and greater productivity. And in a world where there's cost containment, if we can eliminate the need for visits to the practice in the medical world, this is how they make money. Okay, in a world where there's cost containment such as exists everywhere in the world of medicine, that's the answer, is to reduce costs. Well, what happens in medicine is going to happen in dentistry too. So the idea of dental monitoring was to apply this basic concept of remote monitoring to reduce cost and improve quality to this profession we call dentistry. And it all begins with a smartphone, okay? The byword for dental monitoring is less time, more control, and it involves using a smartphone to accomplish the objectives. And I believe smartphones are going to revolutionize the practice of dentistry and in orthodontics. Now, I'm an orthodontist, so I'm going to be focusing on how I've applied dental monitoring in my practice, but I'm also going to be talking about how I use it to interact with the dental community that I serve and how we better serve the patients as well. So it's all about the smartphone, and we're going to talk about how this all works. It begins this way. Patient takes a video. Simply download an app on your phone and take a video, teeth together, a video teeth apart, and a video wide open. That box that you see over there is the answer to making these videos work well, efficiently, and fast, where you have high quality resolution videos that are easy to take. My patients can take a video in a minute, so it's not an inconvenience for them, okay? So it starts with that. Then the video is sent to dental monitoring, and what is created is traditional dental photographs of an orthodontic nature, with the various positions of the teeth and so forth, and it's downloaded onto, it's in the cloud, but it's available to me through my dashboard with dental monitoring. And importantly, it sends reports to me that are pertinent to the things that I want to know about the treatment of my patients, okay? So that's basically how it works. What's very good about dental monitoring is all the reporting that you get, and I have 1,200 patients under dental monitoring right now. What makes it work is that there's color coding that allows me to sift through. Imagine we do monitoring videos on all of our patients once a week. Imagine getting 1,200 reports a week. How do you manage that volume? Well, part of it is color coding. I deal with, and my office deals with, what would be red and yellow or orange alerts. Those alerts tell me there's something that I should be focusing on, something I should be looking at. A green alert tells me that things are progressing as I have planned in my treatment planning. A gray alert is basically there in the interest of completeness and of information, so that the records that we have developed and stored in the cloud on all of our patients are complete. So I really never look at gray alerts per se. My focus is on red and orange alerts. Then what the practice does is we establish when and what notifications we're going to send to a patient. And every office has the ability to customize this communication system. Before dental monitoring, I would be communicating with patients via email, phone call, text message, all kinds of things like that. Now with dental monitoring, our communications are done in an automated way using the dental monitoring app, and it's a much more comprehensive, much more regular and appropriate way to communicate with patients. And the messaging is mine. It's my language, how I talk, how I run my practice. So that's an important thing. And then last of all, what we do is monitoring of all of our orthodontic patients weekly. Dental monitoring will allow you to monitor as often as every 4 days or as infrequently as every 3 months. Our active patients, we do this monitoring weekly. Those are patients with braces as well as patients that are being treated with aligners. We're actually doing a study right now. I teach at University of Illinois. We're doing a study on using remote monitoring to change aligners every 4 days to see if we can do that to accelerate treatment and not have problems with unseats and refinements that come about with changing aligners too soon, okay? So the possibilities of this are huge. And this slide kind of shows what the different color codes are all about, as I've talked about already. How does dental monitoring work? Well, it starts with identifying things that we want to know about on a given patient, and then using artificial intelligence from repetitive views of scans over millions and millions of scans, coming up with information that we know with machine learning is accurate and honest and true. So dental monitoring began as a tool for orthodontists to monitor treatment of their patients, but it's now expanded into all kinds of disciplines of dentistry where we can use the tool to identify things like caries, gingival recession, and things like that. So there's now applications in dentistry as well. To give you some idea of what can be monitored for an orthodontic practice, this slide kind of gives that idea. Do I look at all of these things? Am I interested in all of these things in my practice? I am not. But I've set up my own custom protocol that will monitor exactly what I want to look at and only what I want to look at. And because I can do that, it's a very fast, efficient, and effective way to remotely monitor treatment of my patients. Now, I got involved with dental monitoring 3 years ago. And as you might have sitting there, you might have reservations about how does it work and so forth. So let's talk about my reservations. If this will advance. There we go. Okay. First one is, how good are the scans? Is it garbage in, garbage out? That box has made the difference in terms of getting high quality scans because the focal range is established. It's easy to get a scan that can go second molar to second molar and be a valuable tool for our treatment planning and treatment monitoring. So that was one of the big problems. And initially, 3 years ago, before that box was available, there was a learning curve from not only my patients learning how to use the tool, but also my staff in teaching the tool. Well, that kind of problem has gone away with the box, and I'm happy to see that. I had another concern, which was, how accurate is this? You know, it's one thing to have a scan, but it's another to have a scan that's accurate. So I teach at University of Illinois. We did a study at Illinois comparing the accuracy of scans created by the dental monitoring system with scans created by iTero, 3Shape, and other scanners commercially available on the market. The outcome of that study at University of Illinois was that these scans are as accurate as those 3D scanners are. And that gives us an amazing tool to remotely treat patients. Now, how did we begin? Come on, there we go. We started out this way. Everybody in this room, all the doctors know that when you go away to a meeting, you get excited about some new technology or something like that, and you'll go home to the practice and you want to get going with it. And what do you run into? Staff resistance. They don't want change. They like it the way it's been. So we had to learn how to overcome this staff resistance. And the way that I did it basically is I learned about it at the AO meeting in 2016, and then I went back to the European meeting a month later and spent a couple days with Philippe and the geniuses that have put this program together. And then I arranged to have a webinar basically with my office staff. Why? To get their buy-in. Without their buy-in, very few things happen in our practice. So we did that process. And then we chose to put together protocols and systems where we could adapt this technology to our practice. So that was the next step. And the next step for us was, how do you choose a patient sample? So we decided to start with a sample of 50 patients that would be very appropriate for this kind of ability to remotely monitor care. People who have to drive a long distance to get to my office, kids who are away at college, those kinds of patients where instead of seeing them every 4 to 6 weeks, I can see them every 15, 18 weeks, and I know treatment is progressing as I want. So that's how we started our sample. And what we found is very shortly, before we even filled that sample of 50 patients, we made the decision as a practice to use it on every one of our patients. And so since, I'm going to say, August of 2016, we've been using dental monitoring on every patient that we treat. And today I wouldn't live without it. Now, what is the role of the doctor if you're going to use dental monitoring? This is the most important thing for you to start with. It'll take a little bit of time, but once you've done it one time, you'll never have to do it again. What it is you have to develop your own custom protocol. What are the things that you want to look at? What are the things you want to be getting reports on versus the stuff you really don't care about? Because the dental monitoring, the scope of what they can monitor is huge. So we developed a system within dental monitoring where you set up a protocol and each doctor determines what you'll be monitoring, how often you'll be monitoring, and how you'll react to that what artificial intelligence is telling you. How you'll react will be, what communications will dental monitoring send to me, the doctor providing the care, but also what communications are going to be sent to the patients. Because a big part of the value of dental monitoring is that patient communication, constant communication. You're not wearing your aligners as much as you're supposed to. You're not wearing your rubber bands like you're supposed to. That communication on a weekly basis lets them know the power of the tool and that I'm watching you, okay? And that's very different from seeing patients infrequently in your practice, and when they come in, you've noticed they've got a problem that hasn't been addressed for weeks, okay? So that is how we began, is by creating this master protocol. And in our office, we have a protocol for aligner cases. We have a protocol for braces cases. I've put it together. My staff and I have worked out the languaging of messaging to the patient. So it's the way we talk to patients. It's our languaging, multiple ways to say the same thing, but it's how we want that communication to go. And once you've done that once, the automated system of dental monitoring will pick and choose and run patients through, like if it's a poor brushing case, they won't get the same message week after week. It mixes and matches within the dental monitoring system. Very powerful. Second thing is, I believe in delegation. So what I have learned with dental monitoring is all of these orange and red alerts that I do, I can train my staff to think like I do. If there's an alert that says the brushing isn't good, I have trained my staff, how do you think I would react? I'm looking at the pictures of the patient's teeth. You know, it's not just a message, I'm looking at their teeth. And I'm looking at the same picture with my staff and saying, how do you think I would react to this photograph? And the staff goes, well, I think you would do this. And I said, that's correct. So from now on, they know how I am going to react to that problem. And now I've delegated dealing with these things to them. And I'm only involved as the doctor when something new comes up that they've never seen before. They go, well, Terry, what do you want to do? You know, how do you want to handle this problem? So it becomes a very well-oiled machine. And with the passage of time, as I said, my time involved in doing the monitoring of my patients is very small. How small is it? We have 1,200 patients in dental monitoring, and I would bet doctor time is 40 minutes a week. That's all. The rest of it is done in an automated way, either through the dental monitoring app or through my staff communicating with patients. So to summarize, what are the doctor obligations? Set up the protocols, review selected reports, mentor the team, and then get out of their way. They do the rest. That's the beautiful thing of this. And you're in more control than ever. Now, you might say, okay, what are the staff obligations in such a circumstance? Well, I'm a believer in delegation. I believe delegate to staff whatever they can be trained to do as well as me that's legal. That's my rule, okay? So they have the ability to monitor if someone's not brushing well, if they're not wearing their rubber bands well. So they are representing me in these communications through dental monitoring. But you have an advantage I didn't have. 3 years ago, these protocols didn't exist, but now they do. They're available through dental monitoring. And if you choose to use them, and I would strongly encourage you to do so, they have them available for you. You don't have to reinvent the wheel. Just adapt what we've put together to reflect how you run your practice. It is that simple. Treatment coordinator, the person in our office who's responsible for getting a patient to say yes. What is their responsibility? Communication. Their job is to communicate with patients first. Make sure that they understand what the power of dental monitoring is, the benefit to them, fewer appointments, less inconvenience. Understand that we are remotely monitoring and doing a better job more efficiently, more effectively, more often than could ever be done without the tool. But they also need to communicate to the community so that the community knows, why are we using this tool? The dentists that refer to our practice, the patients in the practice, the people in the community need to know that this tool is available to make their life easier and their treatment better. And importantly, you need to understand that with dental monitoring, you will be seeing patients for far, far, far fewer visits. We see patients now, and you'll see in a couple slides how often we see patients since we've implemented dental monitoring. You're going to need to change how you schedule. You'll have less adjustment appointments to treat your patients. You're going to have to figure out what to do with this extra time. Will you start more patients? Will you take more vacations? You want to go golfing on Wednesday? What do you want to do? But if you don't adjust your schedule, you're not taking advantage of the power of dental monitoring. What's the clinical team's job in my office? Well, they first have to teach the patients how to use this tool. Second, they need to motivate the patient to do the scan. And you might say, how do we motivate a patient to do the scan? Because we ask them to do a scan once a week. The answer is real simple. If they won't do the scan, we get a report from dental monitoring saying, Susie did not do the scan today. Our reaction is we will call the parents and say, Susie didn't do the scan. If she doesn't do the scan by Wednesday, then why don't you bring Susie in? We'll do the scan for you. No problem. Happy to do it for you. If it's too much of an inconvenience to do at home, in front of the fireplace, in the living room, that's fine. We'll be happy to do it. You know what? We do a scan once or twice. They figure it out. They do the scans. And we need to use the software to communicate. All right, we've talked about that. So far you're saying to yourself, this looks like a lot more work. Where's the time savings? Well, let's get into the time savings that come with dental monitoring. What's in it for the practice first is far fewer visits. We've implemented in our office a concept called appointment on demand. If you think about medicine, that's what they've done in medicine for decades. Appointments on demand. We'll let you know when you need to come in. With dental monitoring, I'm reviewing my patient's treatment weekly, using my staff as a tool to make that functional for me. Our patients today are told, we will let you know when you need to come in. So instead of scheduling an appointment every 4 weeks or 6 weeks or 8 weeks or whatever you happen to do in your practice, I might not see them for 20 weeks unless there's a reason for them to come in. So there's savings. Better running on time. You ever have circumstances in your office where a patient comes in and there's surprises like loose brackets you didn't know about, they lost their aligners, there's attachments missing, all these different things that'll really mess up our day because we now need to do more than the time that's scheduled. With dental monitoring, I always know what needs to be done before they come in, and we schedule the appropriate number of minutes so we're more efficient and we run on time all day long. Shorter, fewer doctor time. In a world where there's competition, in a world where third parties would want to control our destiny as practitioners, we need to figure out how to do a better job, faster, in fewer visits if we're going to compete in the changing world that we're living in. And what you'll find with dental monitoring is since you're catching problems earlier, you're going to finish treatment earlier. Now, how much of a difference can this be? Well, what's in it for patients, first of all, is fewer appointments. Patients and parents love that. Less inconvenience, less taking them out of school, all those different things. You're going to have shorter appointments, faster finishes, and less time, more profit. 5 appointments to treat a patient with aligners in our practice. 5 appointments. But it's only possible with dental monitoring. Our appointments are shorter. There's less refinements necessary because we're catching unseats before they get to a point that we have to order refinement aligners for that. And we can finish all our patients sooner. How about some examples? Well, photo monitoring is what's used for aligner treatment. Works very well. What it basically is this. This is an example, patient from our practice, 2 weeks between that photo and this photo. Look at the amount of unseat in the lateral incisor in that 2-week period. In a traditional Invisalign world where you might see a patient every 8 weeks, how bad would that get before they came in? It's a guaranteed, you got to order aligners for, to do refinements in that circumstance. But now what we're doing is we're doing photos weekly, and we're not having to do refinements anymore because of unseats. Now, we still do refinements because the occlusion isn't the way we want it. But if you can eliminate unseats in your practice, what's that going to mean for you? What's that going to mean for your practice? The profitability, the number of appointments, and so forth. So that was an unseat in 2 weeks. Not anymore because dental monitoring has a program called DM Live. And I think of all the things in the show, this is the most important thing. If you're an aligner treatment doctor, here's how it works. The artificial intelligence is going to evaluate every scan within 12 hours. And you will get a report on whether there's unseats or not, whether there's progress according to your aligner treatment plan. You've set the parameters for what you want to do and how often these patients will do scans and even the messaging that's been done. And artificial intelligence built into the dental monitoring system as a result of machine learning is extremely accurate, as I've told you before. And the patient journey is this. The doctor explains. The patient installs the app on their phone. So they have the app on their phone. The patient receives reminders to do a scan. So in my office today with aligner patients, they're getting a prompt through the app that says, do a scan every 4 days, because we're changing aligners every 4 days, okay? The software will allow that patient to do a scan anywhere they want. They can be on vacation, they can be in the living room, they can be anywhere they want. And the software of that scan allows it to be sent to Paris, which is where dental monitoring's headquarters is, and they process and send to me the report that I get within 12 hours. If everything looks good according to the protocol that I've set up, the patient gets a text message that says it's okay to go to the next aligner because things are tracking. It allows us to optimize how frequently a patient can change aligners, and we're having them change aligners every 4 days right now. We can give instructions involving that also. If treatment isn't tracking, they get a prompt from us that says you can't change your aligner. We're getting an unseat. So we want to leave that aligner in longer to recapture that tooth before we move through the progression of aligners. What does that do for refinements due to unseats? It's a game changer. It's amazing. Also, the patient who doesn't wear their aligners enough, you've caught them because they're not tracking. And they're getting repeated messages, you can't change your aligner, you can't change your aligner. Why? Because you're not wearing it. You can't change it. You can't go to the next one. So you're getting notifications of all of this that goes on. And you have the opportunity to send your patient instructions as you have customized for how you run your practice. So think about aligners. These are three things that every aligner practitioner has to deal with. Aligners not fitting. How often is the optimum rate to change aligners? And how long between visits? Any aligner doctor, those are three questions you need an answer to. And with dental monitoring, you can get answers to all three of those questions. And if you can change aligners faster, you're going to make happier patients because they're out of treatment faster, especially if their treatment is tracking and are not going to have refinements resulting from unseats. So what does all of it mean to you? Well, this is what it means to me. Huge savings of time and better control of treatment as well. And the concept of appointments on demand is a medical concept, been around for decades, that I have now applied to my orthodontic practice. Patients leave my practice, they are not given a next appointment. We tell them, we'll let you know when you need to come in. As long as you do your scans, I'm actually seeing you more often, not less often. That is powerful. Now, this statistic, if you don't remember anything else from my program here, this statistic is huge. Gage is a company in the United States that is a practice consulting company to 1,400 orthodontic practices in the United States. These are their statistics from 1,400 practices. The average bracket case in the United States requires 19 plus adjustment appointments to be treated. The average aligner case requires 12 plus adjustment appointments to be treated. What's possible with appointments on demand? In my office, to treat a bracket case, from the day I place until the day I remove, I'm doing in 10 or less visits. Aligner cases, from the day we do the scan for the aligners until we remove attachments and give them retainers, is 5 or less appointments. Think about what that can mean for your practice. Think about that. This is a game changer. So appointments on demand, how does it work? Well, it starts by determining how often you're monitoring. For us today, it's every 4 days. Machine monitoring with DM orthodontists, making sure that the reports that are resulting from machine learning and AI are accurate, following my monitoring protocols, and the staff is addressing the prompts, the red and the orange prompts. My staff is managing unless they see something they don't know how to manage, okay? Staff-only appointments. What would that be? If you have patients with brackets, you're going to have to change their elastics once in a while. You're going to have to do oral hygiene instruction much more often than aligner cases. These are staff-only appointments. So these patients are scheduled, but for no doctor time. They're in the office because of this other issue, but it's not something where I need to see them because I've already made a decision on what's necessary based upon the DM scan. Is that making sense? Okay. So what would represent a doctor-only appointment? Only what requires me to be there at the time that they are there. It's a game changer in how we practice orthodontics. So let me talk about how we've applied dental monitoring for retention patients. I believe every orthodontist in the world is faced with a dilemma. You take the braces off, you give patients retainers, and the dilemma is, how long should I see them afterwards? You know, what's my responsibility? And, oh, by the way, what happens when something goes wrong? We all struggle with this. We all have to deal with this every day in our practice. I've come up with what I call a retention guarantee. Our retention guarantee goes like this. All my patients have been through dental monitoring, so they know how to do the scan. I see them for 1 year in retention, and then we dismiss them. But at 1 year, they get the opportunity to take advantage of our retention guarantee. The retention guarantee is this. For $800, I will guarantee my work for 10 years. Now, how can I possibly do that? They take a scan every 3 months. How bad can things be in 3 months? Dental monitoring will catch the patient who didn't wear a retainer, the loose bonded retainer, whatever, long before it becomes a retreat. It's just a repair at that time. And we have them scan their teeth every 3 months. As long as they scan their teeth and do with their retainers what was their instructions, I will retreat them for free for that $800 fee. Now, here's an interesting statistic. 25% of my patients take that guarantee. And I am obligated to provide them whatever for 10 years. 75% did not take the guarantee. I now have, they know if they don't take the guarantee, we're done with them in a year. Anything that happens after that, there's a charge. I've solved the age-old problem of how long should I see them, and if something goes wrong, do I charge them or not? That's the power of dental monitoring as well. So we can detect these problems earlier with a retention guarantee. And I'm going to go through this key take-home comment. First of all, the time that you save from appointments you don't have anymore, from shorter appointments, far exceeds the time it takes to use the tool to monitor patients remotely. And the convenience to the patients and parents is a huge practice builder. Convenience sells, okay? Automated messaging improves our communication with patients, and that is a practice builder. And we're treating patients in 60% less appointments than before dental monitoring. That's a huge number. Think about what you could do with that extra time in your practice. Now, I'm going to finish with the elephant in the room. I'm from the United States, and I don't know how many people in this room are from the United States, but I'm telling you what's happening in the United States because it's coming to your town before you know it. It seems as though whatever happens in the U.S. somehow makes it to other countries over time. Forbes magazine had this article about what they called the changing world that began with Invisalign. Lots of people entering the marketplace with aligners. And as you go to this meeting, you can tell there are many, many companies. Now, I don't call that the elephant in the room, to be honest, because when there's more companies providing aligners, supply and demand is going to cause the likes of Invisalign and others to charge us less. So I think that's a good thing. What do I mean by the elephant in the room? Direct-to-consumer orthodontics. This is a picture I took of a kiosk in a shopping mall in my home, Smile Direct Club. Smile Direct Club is direct-to-consumer orthodontics. Where I practice, the biggest department store is Macy's. Macy's will sell for $80 a kit for a lay person to take impressions of their teeth with putty, send it to Smile Direct Club, and in the mail they will get aligners to treat their case. Never saw a doctor. There are many other direct-to-consumer models like Smile Direct Club. Macy's, Bed Bath & Beyond, Best Buy, CVS Pharmacy, Walgreens pharmacies all sell these kits for $80 for patients to get orthodontic care without ever seeing a doctor. And you might say, well, where did that come from? Well, look at the medical model. 50 years ago, medicine was a commodity industry. Solo practitioners taking care of a population of patients. And then it became corporatized. $1 trillion business today. It began with individual physicians joining together in a group practice. The group practice was bought by a hospital. The hospital was bought by a corporation or an insurance company, and everybody works for this third party. And what was the name of the game? Control costs. That was how the mechanism occurred. How can we control costs? The way cost was controlled, go back one. Delegation technology and remote treatment. I started my slide series talking about remote treatment in medicine. We have to apply this model to dentistry and to orthodontics if we are going to survive in a changing world of direct-to-consumer healthcare. So, yes, our smartphones could very well be the paradigm shift that we need to survive in our professions of orthodontics and dentistry. But I think the ultimate differentiator we can give that will help us survive is giving patients convenience along with quality. And that's where dental monitoring absolutely is the best. So our world is changing. We need to learn how to treat patients better, faster, and more cheaply. Remote monitoring, to me, is the answer. Less time, more control. Carpe diem, seize the moment. Thanks for listening.